Okay, good afternoon, everyone, and welcome to the NUS ISS Learning Festival 2025 Virtual Online Edition. My name is Janice, and I'm a principal lecturer with the Digital Health Practice here at ISS, and I'll be your host for today's Fireside Chat. So today's webinar was very much inspired by the tremendous response that we had for the face-to-face learning festival that we held at the Institute a few weeks ago. And so we wanted to build on that momentum by extending this to more audiences across Singapore and also across beyond Singapore. In fact, I think we might have some participants joining us from as far as India and even Malawi today. But anyway, at NUS ISS, we're committed to executive education that goes beyond theory, that we can apply in industry and in the workplace. And that's precisely what today's webinar is about. We're going to dive under the hood and talk about the AI adoption journey that my guest here has undergone. And I have here with me today Ms. Yujuan Tan, who is the CEO of Parkway Radiology and Parkway MediCentre. Welcome, Yujuan.
Thank you.
We're
Thank you very much,
very glad to have you here with us. So welcome to our guest speaker, and also welcome to everyone who is on this webinar joining us today. So Yujuan, maybe you just tell us a little bit about yourself, because I understand you've been with Parkway Group since 2015.
After all the radiology businesses of the IHH group within Singapore, and that represents the 4 hospital radiology departments, as you can see here, and a network of clinics across the island. That little image on the bottom is actually our latest launch. It's our Memo Express, our mammogram on wheels, which is our effort to bring screening more, make screening more accessible to the community.
Wow.
So every year we do almost 500,000 radiological examinations for patients in Singapore.
Wow. So that's a big and busy shop that you run. So thank you for all that you helped us do in healthcare. So I'm curious. I mean, we know that imaging and diagnostics is typically an early part of the patient journey, because with diagnosis, then we know what's wrong and how to treat it. And that imaging is important because it helps us look at structures within our body.
Right.
So we're familiar with terms like, PET-CT, or we've heard of things like CT, MRIs, X-rays, ultrasounds. But that's been around for a while. So tell us then, what does the AI do? How does it help make all these services different from in the past?
Yeah, so AI is by today in every aspect of healthcare. So the machines you mentioned have themselves also evolved a lot and adopt quite a lot of AI within their workflows and in their post-processing software as well. But the ones that I think I would like to highlight in our journey in Parkway Radiology is our adoption of AI solutions in the diagnostic reporting stage of the whole patient journey. So over the past 2 years, we have put in place 3 deployments across 3 different modalities. So we started off, our first one 2 years ago was adopting a software from Korea. It's called Unit Insight Mammogram. And the images here show you what the radiologists actually see. So in comparison with a standard black and white mammogram image, the radiologist using this software will see a heat map which will highlight questionable lesions, give a certain scoring to it to indicate the confidence level of the software, and also characterize the breast. And in Asia, we have typically women with a lot of dense breasts, and that changes how you evaluate the whole report. So the combination of this information from the AI aids our radiologists in coming up with a more accurate report for breast imaging.
I guess that means in the past, the radiologist would just have to eyeball a black and white image.
Correct.
But here it's pinpointed out in color to help them notice more things and help
Absolutely.
make that decision.
Correct. Yes. So that was our first one. And the second one was CT lung nodule detection software. The product name is SenseCare. It's from China. And the interface you can see actually is quite different from the mammograph one. The way this software works is that we have to use a separate application And within that application, the engine runs and it pulls out all the nodules. It does quantification, characterization, and of course, the radiologist has to scroll through all that to determine whether or not it is accurate. And after that, they can use the generated report and copy some of these findings into their final diagnostic report within our PACS system.
So meaning in the past, the radiologists would have to manually count the nodules themselves.
Correct. Yes.
But now the AI is picking them up and say, here's the list, you verify.
Indeed. Yes. So there's a lot of mental load on the radiologist in going through every slice of the image. As you know, CT images are very high in data quantity. And they have to be very clear and start to measure and use all the tools within PACS to do the work that now the AI is doing on their behalf as a first step. But it still goes through the radiologist's human assessment and through their experience to validate whether or not this is indeed true or false and whether they agree with how the AI has characterized it.
Okay.
So that was the second one. And then the third one is, of course, the most prevalent diagnostic examinations, the chest X-ray. Right. So for this, it was an Australian-based solution. This is one of the, I would say, most superior chest X-ray AI solutions out there because it not just diagnoses 7 chest findings. Because when you're looking at chest X-ray, you're looking for, yes, answering the clinician's question, like, is there a pneumothorax? Okay. But you also, as a radiologist, are responsible for verifying all the other hundreds of possible things that could go wrong or incidental findings in the chest X-ray. So Harrison AI's chest X-ray is able to pick up to 126, if I'm not wrong, chest findings. Right? And the most important thing, as you can see in this one, is the way the results are presented. It's slightly different from the other 2 applications, whereby it's a PACS overlay. So this is one thing you will hear very clearly from radiologists. I don't want to change my workflow. So the radiologist just opens up the chest X-ray study as he would normally do to read, and there's a pop-up on the top right, a very subtle pop-up, as you can see in the image on the left, and it will also flag out the areas of interest as well as some of the findings which the AI tool has picked up. You can choose to ignore it, we can choose to address it, and you can choose to copy it. So it doesn't interfere with their workflow at all.
Right.
And it's instantaneous.
Wow. Okay. You know, for most people, their first idea or interaction with AI is ChatGPT, right? And that really kind of just exploded into public awareness in 2022.
Right.
But we do know AI is much more than that. And it's also been around for a lot longer, since the 40s or 50s. And here already you're showing different use cases in different workflows and different ways to use it. So, you know, and they come from different parts of the world as well. So, you know, now that we know some of what AI can do or what it's doing for you, maybe let's backtrack a little bit to the origin story.
Sure.
How did you start even thinking about AI? Was there a particular challenge or a moment or a trend that kind of made you think, okay, let's start, right? Because it's not an easy journey. So how did it begin for you?
Okay. So for some context, I actually do not have a clinical background, right? I have a very, very, very robust team of clinicians supporting me behind this. But when I first joined radiology in IHH Healthcare, I had the privilege of attending RSNA, which is the radiological conference of the year in Chicago. And in 2017, when I went, I was blown away by the growing excitement and interest in AI. So typically that conference will showcase a lot of new machines, right? But there was this dedicated section on AI. And fast forward to today, 8 years later, that section or small little section has become an entire hall of AI solutions. But this chart, I feel, really encapsulates the boom of AI. So I mentioned 2017 is when I attended. And that's around the point where you can see the green bar, which represents radiology AI solutions approved by the FDA. You see how much that has grown and how dominant that green bar is compared to other specialties in the field. So it was really not one moment. It was kind of like an inevitable thing that having this position in radiology, you have to take a look at what's happening and you have to try your hand at it. And thankfully, we got some successful deployments.
Right. Okay. But I think it's one thing just recognizing the trends around you, but also implementing it, right? Like they say, culture eats strategy for breakfast every day. So what were some of the first few steps you took in trying to make it a reality within your organization?
It was extremely clumsy at the start, I would say that. So in the earlier days, back from the conference with a bunch of brochures, you start contacting the vendors and say, "Hey, let's see what we can do." So I think our first couple of approaches were quite messy, right? So we
What do you mean by messy? Define messy.
Yeah, so we would have a meeting with the solutions provider. They would show us what they had, and then we would focus a lot on the accuracy of the solution. We would demand they show us white papers and stuff like that. And then we took the now seemingly logical next step of feeding them anonymized data and evaluating the results. So we went through all that pain, but it was very slow. It was very inefficient, and a lot of the times we were held back by certain things which we now know are given, which I can share more later. Say, for example, entering an NDA. And then ensuring that they...
non-disclosure agreement.
Correct, a non-disclosure agreement.
With whom? With the vendor, solution
provider,
provider.
right? Of mutual NDA.
Mutual NDAs, right?
Ensuring that they meet your personal data requirements. Ensuring they meet your cybersecurity requirements, even for a pilot or a trial, right? So those were, achingly long processes that we couldn't overcome very quickly. And like I said, we focused very much on, this is not accurate enough, and then it was also the nature of the solutions at that time. They were relatively more focused on the algorithm rather than the application.
Right.
So you could have a super, in the lab, very good one, but it was very hard to fit them into our workflows.
Right.
So quite a few of the early trials and pilots, we could not see ourselves implementing it.
Okay. So it sounds like, it really was dependent on what the solution providers had.
Correct.
That when they came to you, right?
Yes.
I guess as a large organization, did you ever consider trying to build something yourself? I mean, that's a big question some MNCs have, right? Build or buy. And how did you, address that?
I think for us, it was always very clear that we were not in that business, right?
Okay.
We are primarily a healthcare services provider. That was our strength. That was our core competency. We had internal discussions before whether we could develop, but thankfully, on hindsight, we didn't, because you would require an army of data scientists, and there's a whole breadth of solutions you need to you could potentially explore, right?
Right.
So you can see we already have 3 deployments, but those are only 15% of all our studies, right? So in order to fully make your AI in-house team, work, you really have to prioritize what your use cases and make sure you have the best use of those resources. So for us early on, it's quite clear there's enough out there for us to feel around and just deploy.
Yeah. Okay. And you mentioned like you don't have a clinical background, right? Which is an interesting point, because recently I heard, so Jeff Hinton, right, who some people view as the godfather of AI, and he's based in Canada now, but he famously predicted that radiologists would be out of a job in 5 years' time, right? And he proclaimed this in 2015.
Yeah.
It is now 10 years later in 2025, and radiologists, as far as we know, are busily employed. But I'm just curious, were there any troubles, convincing your radiologists or even your radiographers and other members of your staff to get on this AI bandwagon?
Yeah, certainly. So I think that notion that he put forth has certainly been a thing of the past. Now the catchphrase is radiologists who use AI will replace radiologists who don't use AI, right? I think we have truly embraced it as an industry. But nonetheless, I have 40 radiologists, 40 different personalities, a wide spread of age and experience. So there will be some skeptics in the system. However, I would say if you truly meet their needs, so say for example our chest X-ray application, then the adoption becomes very much easier. It's very easy to convince someone to use something if they see value in it, if it doesn't impede their workflow, right? And the greatest the moment where I knew it was successful, the chest X-ray AI deployment, was when one day the system was down because there was a server issue. And I received a whole flurry of complaints from the clinicians. That to me was a sign that, okay, they have embraced it.
Right, because now they can't do without it.
Correct, yes.
Right. Okay. So that's a pleasant surprise, actually. Were there unpleasant surprises along your journey, right? Because now, if I imagine it, in maybe after 2017, 2018, you have a bunch of brochures, a bunch of vendors knocking at your door, you're meeting people, you're assessing the accuracy of their models. But then how do you sort of shortlist, right? And then you matching it with radiologist interest to see which use cases to pilot and how do you move that forward?
So in terms of unpleasant surprises, I wouldn't say unpleasant, I guess
Unexpected
surprises.
hurdles or challenges.
I think when we launch into AI projects, a lot of the expectation is productivity gains, right? But for very experienced radiologists, going back to the chest X-ray example, they report chest X-rays in like 15 seconds, right?
Okay.
That's
What
especially
gains are there
screening
from
chest
15
X-ray,
seconds?
right?
Yeah,
So,
yeah.
yeah, exactly. How much more can you tweak that down, right? So we also learned that, hey, actually the greatest value in AI adoption, especially in the diagnostic reporting phase, is not so much the productivity gains, especially for these quick turnaround examinations.
Oh, wait, hold on. So you're saying that initially the premise is that people think there will be productivity gains from deploying AI in radiology, but you're saying that was not your initial findings.
That was not.
And it's still not your today.
Not in my context, right? There are certainly other institutions globally that are overwhelmed with a shortage of radiologists that have benefited in that regard. But for us, it was exactly like a 15 seconds chest X-ray turnaround time. How do you beat that? So we have learned actually the surprising thing was actually the value in diagnostic competence is something we cannot really quantify, but has been the greatest gain for us in all the applications that we have put forward.
Right. Does that mean clinician satisfaction or clinician confidence, as you said?
So the radiologist, when they report, naturally is a human he's using his eyes to look at something, right? That's the traditional way of doing it. A lot of it depends on how alert they are, how well trained they are. So there is that human factors to take into consideration. Now with essentially a 24/7 second reader for those examinations, their mental load is a lot less. They can check in with this reliable solution by their side at any time.
Right.
And together come up with a more accurate result.
Right.
Together.
Yeah. So I guess, not to use an overused term, but they almost like to have a co-pilot or a support, someone a tool to help verify or pinpoint certain things or raise for their attention.
Yeah.
Right. Okay. So I want to go back to something you mentioned earlier about the initial stages whereby you were very focused about the accuracy of the models themselves, right? I do think that is critical because we talked so much about the promise and hype of AI, but AI does come with very real challenges which we need to be aware of, whether they're hallucinations or whether they're bias. And the bias particularly is critical in healthcare because also, if a lot of these solutions are developed overseas based on different populations that are not, I guess, Asian genotypes and phenotypes,
Correct.
then do we have to adjust this to reduce the impact of these biases?
Yes.
So my question is, what if you were concerned about the accuracy of these models, what steps or validation processes gave you confidence that the AI was clinically safe and effective?
Yeah. So of course, in the first parts of the trials and the pilots and using our own data to test the system, that's a very critical part, right? And if that hurdle is not crossed, if our clinicians, our radiologists are not convinced, then it's certainly a no-go, right? So in order to do that, we take a closer look at the data sets they're trained on. You can see from our selection of solutions.
So the data sets that the models have been trained.
Correct. Yeah.
Right?
So it's not a coincidence that there are two of the solutions coming from Asia, right? Because we feel that the demographic that they're representing or have tested the data or trained the data on is more representative of our target demographic.
Okay.
In terms of accuracy, a combination of studies, papers, other deployments, own tests, internal tests of a relatively reasonable sample size is what helps us convince ourselves, okay, let's go beyond pilot, let's go to the next stage. But at this day and age, accuracy really is just the entry ticket, right? Once you clear that hurdle, that's just almost a hygiene
factor.
Exactly.
Right?
Yes.
Your model has to be there. If not, there's no
correct.
conversation.
Exactly. Then we talk about all the other things that make us decide whether or not to actually invest in it. And that would be things like, how easily it fits into your workflow, how reliable the support team is, right? Because it is ultimately a software solution. And if a software solution is not reliably supported, you can't deploy it in your clinical workflows confidently.
Right. Okay. So I wanted to get to how you implement that, but just one last question about safety, right? Because I think we want to be ethical and responsible implementers of AI, right? Because we owe a responsibility to patients. So when it comes to patients then, how has your experience been, or how do you communicate with them on the role of AI in their care in a way that feels transparent and reassuring?
Yeah, this was also a learning moment for us. So when we use deployed AI into our reports, right, we realized that there were a lot of things we had to figure out after we deployed. So from standardizing the way our radiologists use the solutions, because within each software there are certain configurations you can tweak. For example, confidence thresholds and so on and so forth. So we had to first of all realize that, this better be consistent across all our 40 radiologists.
Wow.
And then we realized very quickly that, hey, we better make a mention of this to our patients, right, and to our referring clinicians, because there will be a palpable change in how we report. So we landed on the best possible way of doing so, which was to put a footer in our reports that use AI. It's a very standardized footer that makes reference to the use of AI diagnosis tool in aiding us in the creation of the reports. For certain applications, we even state the thresholds we use in accordance with what international standards. Wow. So it gives the clinician and the patient some confidence that, they're telling me they're using AI, and they're doing it not blindly. They're doing it with a lot of thought, and it's configured for my report. So that's kind of how we have communicated it to our referring clinicians and our patients.
Right. I can see how the standardization is helpful. But did you go to the point of actually creating, I guess, like clinical guidelines or SOPs, whereby, everything is quite mandated and tightly controlled? Yeah. Because each radiologist is an expert and a subject matter expert and independent in their own right.
Yeah.
So how does that jive then?
Yeah. So thankfully, we only have a handful of actual deployments right now, the 3 of them. So we're still able to control how they're being utilized. We are in the process of coming up with more robust frameworks. In fact, IHH Healthcare as a group is going to launch our AI and data governance framework for applications across the group, across all geographies.
Oh, wow. Across like 10 different countries?
Correct. And all our hospitals and healthcare facilities. So it's a big step. I think it's also a reflection of how important we see this is in adopting and using AI safely, ethically, responsibly.
Wow. Okay. So right now, just to clarify, these deployments are for the Singapore market, not yet in other markets, right?
Correct. Yes.
Okay. But eventually, I guess with this IHH-wide framework, it could be scaled up.
Absolutely.
Wow. Interesting. Okay. So, moving on. I'm still curious about, the actual implementation. I guess one question is, beyond trust and safety, the other side that every healthcare leader has to balance really is the business and operational impact. And you alluded to that, right? Yeah. So maybe you can talk us through the process of how you roll these projects out. And from a CEO's perspective, how do you evaluate the business case for AI adoption?
Okay. I wish it was a simple answer. I wish there was a standard Excel template you could throw the figures in and say, all right, let's go with this project.
Yeah. It isn't?
No, it really isn't. So most AI solutions, especially in the diagnostic reporting space, they do a pay-per-use, right? So per study, they will charge you a certain amount. And it's usually tiered pricing based on your volume of studies. That's a very standard pricing model. So for you to decide, is this extra dollar I'm paying for this chest x-ray, hypothetically, worth it, right? Because the chest x-ray can range from $10 to $48 right now, right? So how do you make sure that it's worth that $1? You could go down from 15 seconds, it became 13 seconds, and then you multiply it out, and then blah, 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 blah. But like I really said, that's really not the what we saw when it came to the chest x-ray.
And this is the cost to the operator, not yet to the patient.
No,
right? It's whether you choose to pass on that cost, right?
Exactly. So in the US, there are a few institutions that actually give patients the options. If you want an AI-aided report, pay extra $40 because insurance don't reimburse for that. And there are some patients from experience who actually fork out the extra $40 because, I'm really going to have a more accurate report. But I think that's a very dicey space which we are not prepared to get into yet. So going back to how we quantify it, a lot of it is the confidence of the radiologist in the accuracy of the product and how much it can add value to their workflow, and that diagnostic confidence, which I have to say is very difficult to quantify.
Yeah.
But I will say this, in our deployment of the CT lung nodule software, although we didn't do an ROI modeling to say this is what will come with if we invest in this, having deployed it for about a year, I've seen our volume of CT lung screens grow because our reports are way better. The depth of the reports and the accuracy of the reports are better. And clinicians have that built up confidence. They know we're using AI, and our volumes for that study have grown 30% year on year.
Oh, wow.
Yeah.
Okay.
Something I would not have expected from the start.
Right.
So this has changed a little bit the way how we reframe, how we invest in some of these AI solutions as well.
But is it fair to say the patient may not be aware of the increased accuracy, but it's the other specialists, right, who have also growing confidence in the radiologist report?
Yes, correct. The nature of
Wow.
radiological exams in Singapore and most countries is that it must be referred by a clinician.
Right.
And therefore, the indirect customer for us is actually the
Other
doctors,
specialists.
the specialists.
Yeah,
right?
yeah,
So
yeah.
they understand that, hey, this report is different from before.
Wow. That's even a greater testimonial, right? Where other professionals respect your report even more, right?
Yeah.
Wow. Okay, that's really quite powerful. But I see here we have a sort of a process map, if you may.
Yes.
Maybe you can walk us through then. It sounds like, through different trials and errors and proof of concept, you seem to have worked out a process in which you can move projects from inception to completion. Can you walk us through this?
Yeah. So after a few misses in the early stage and some hits, I think it was clear that we needed some guiding principles in our approach, right? So this is nothing too scientific. It was really just penning down our experience and what are the logical steps and things we need to move from each step to the next step, right? So of course, if I can walk you through this, it starts from the cold call from the vendor or the conference meetup or introduction to a certain solution. And for the record, if there's one piece of advice I want to give anybody, it's challenging, but I hardly turn down an AI introduction.
Oh, wow.
Yeah,
okay. So
that doesn't that doesn't open a can of worms because you
entrepreneurs,
never know what you're missing out, and it's changing so fast.
Yes.
Okay. So there's a whole bunch of that creates your original funnel of solutions.
Funnel of potential opportunities to implement. Okay.
So implicitly from step 1 to step 2, we have some ideas of how to select things that are more ready. So early stage, pure algorithm, no interface, I think that's way too far from us to do commercial deployment, right? So those quite quickly get tilted out.
Right.
But once we decide, okay, this is something worth a shot, we do a pre-trial assessment with usually a demo account or a demo system. And we have learned that we need to document our evaluation at each step, even after product presentation, right? Because 3 years later, the same sales manager will come to another teammate and be like, oh, let's take a look at my product again. We want to make sure we have a knowledge database for our
the
entire
institutional knowledge is
exactly,
not lost,
yes.
right?
So we do have that database already for each of the AI solutions that we have encountered.
Right. Okay.
So pre-trial assessment, then a POC trial. This is where we feed our own data. To your point about the accuracy, right? We have to make sure the solution that is developed meets our demographic needs, right? Majority heavily Asian, Singaporean, certain age groups, so on and so forth.
Sorry, just to,
sure.
That means you have this database of anonymized patient data, which you feed through the potential model, right? And you see how that potential model performs compared to your gold standard, which is your existing radiologist, right?
Correct, yeah. And it's retrospective data. So we don't have to heavily involve radiologists at this point. So, for example, if it's MRI liver software, okay, here are the 100 MRI liver studies we have done in the last year. The images are here. Go show us what you have. The reports come out and we compare how much they differ from our radiologist reports retrospectively.
Okay.
And you can see the POC trial is a much longer list of things, right? This is where the hard work is. Okay. This is where the team goes beyond your radiologist, your radiographer, and myself, right? It's the IT team. It is the data compliance team. It's your legal team that has to check through all these things to make sure that whatever you're going to do is safe, ethical, and responsible.
Right.
These are the guardrails.
Right. Okay.
So by now, we have very standardized documents that cover all these aspects, right?
Oh, okay. Okay.
Then again, evaluation, pricing, negotiation, deployment, and all that. And then we decide, okay, go or no go. And then finally, it's the actual deployment. And post-deployment is doesn't end there.
Right.
There's the training, there's the deployment, there's the troubleshooting, there's the post-go live issues, and user feedback. And most importantly, we learned after go live, it doesn't just end there. There's a lot of studies now on model shifts, demographic shifts, right?
Yes.
So our deployments are relatively young, but we are still constantly evaluating them. We are still trying to figure out the most appropriate time intervals. We're looking at monthly and then moving to quarterly and then biannually
Right.
to ensure that, hey, this is still cutting it.
So it's not just once off. It's not like
No.
you deploy the AI tool and you let
Hands
go.
off.
It's not
No.
look ma, no hands. It's actually
exactly.
the continued commitment, right?
Yes.
To continuously monitor for potential changes. Sorry, it's perpetual commitment, essentially.
Exactly. Yes. Yeah.
Wow. Okay. So how long would this take? Or I mean, it may not be a one size fits all, but to go through from, product presentation to post deployment, how long has it taken you typically? Just for the 3 that you've mentioned that successfully made it through. I'm guessing some didn't make it.
Oh,
So-
30 didn't make it.
Yeah. I mean, what is the success rate even, right? Yeah.
Okay, I'm too embarrassed to tell you the total number of failed projects. But the success rate is not that high. But 3 is something we are very proud of, and I think it's probably more than most institutions. It represents 15% of our study volume, actually.
I would actually assume a very high failure rate, just because,
absolutely, yes.
right?
Or rejection rate, like things drop
just
off from every
on the
part
side
of the journey.
caution. Yeah.
The question was
How long would
how long
this
did it
take? How long
Yes,
would this
okay.
journey take?
minimally 6 months.
Okay, that's actually
Minimally 6 months.
not too bad.
Mm.
I think 6 months.
So it brings me to another key success criteria, which is the partner, the vendor, the solutions provider. How responsive they are, whether they have the resources locally to drive the things forward. How willing are they to listen and adapt and make changes where necessary to make sure your workflow, their solution fits your workflow and not the other way around.
Right.
If the vendor is extremely all hands on deck, it can be super fast.
Right. Okay. So you need you need good partners.
Absolutely, yes.
Right. Okay. So then, I love it that, we've talked about technology, we've talked about processes, and even some about the outcomes. But none of this happens really without people, right? So successful digital transformation really depends on teams that are equipped, engaged, and confident in just being open about using new tools.
Correct.
And leadership plays a huge role in that. I'm sure you're aware. So, what kinds of new skills did you or your team need to develop to successfully integrate AI into their work? Because it is something monumentally quite different. So
Yeah. As you can see, most of the deployments so far are very much limited to the reporting room, right? So the bulk of the clinical teams or even administrative teams involved in the whole patient journey is not yet so impacted by these deployments, right? But nonetheless, we're making an effort to keep talking about it. It's not just something that sits in amongst 4 or 5 people and then it gets deployed and then nobody knows what's going on, right? We talk about it, we're proud of it so that the rest of our organization understands that, hey, this is helping us as a business. And yes, it will soon maybe affect my part of the patient journey as well, whether it's patient registration, whether it's triage, whether it's protocoling, and so on and so forth. So right now it's a combination of awareness. When it comes to the deployments, up to date, I myself have been very heavily involved in each of these deployments. We're trying to scale up by moving beyond the SWAT team of people deploying and trying to decentralize some of the AI deployments to their respective hospital departments by equipping them with all the tools we saw earlier in the flowchart, and then assigning projects that make sense for individual facilities. So that's how we're trying to bring people along in the whole journey as well.
did you have to set up a new team, like this new SWAT team, or how did that come together?
It was It was not a fresh new team, but it was a very natural selection of profiles. We needed a technical expert, a radiographer, an IT person, extremely important, who gets it in terms of, interfaces and user specifications, and a clinician lead, right? So we had these like magic trinity in place.
So clinician lead in addition to the radiologist lead.
That would be the radiologist.
Okay.
Yeah.
Okay.
That can really stress
So
test.
clinician lead, an IT lead, and a business lead.
Yes, and also somebody to help string everything together, like
Right, like a project manager,
That's it,
right?
yes,
Right.
yeah.
Who's the glue to bring everyone together.
The one that hounds the vendor for all the checklists and so on and so forth.
Oh, it's actually quite a small, lean SWAT team then, I might say.
At the get-go, when you're doing the first few steps, yes. Yeah.
Okay. Wow, okay. So, and then, I presume this journey is not always just a straight line,
No.
escalation and all that. So there could be peaks and troughs, right? And you mentioned this has been going on for a few years as well. How do you maintain that momentum, for staff, especially if they face-to-face setback, or they just have change fatigue potentially, How do you continue to motivate them?
I think it's no denying that AI is here to stay. So we set targets for our team, I'll be very honest. I personally fully believe that we need to embrace it even more. So we make it part of their work plans, that you have to trial. You don't have to succeed, but you have to get your hands dirty in one solution pilot, right?
Right.
And that is not just about a successful deployment, it's about understanding the thought processes and the deployment process of an AI solution. So at the moment, we have maybe 5 trials running.
Oh, okay.
Yeah. But it's all, done at a decentralized level. So we have moved on from a SWAT team, very controlled, to try and spread it and scale it to the respective facilities.
Like they say, let 1,000 flowers bloom. So they're trying, at least that's one step closer to possible deployment.
Yes, correct. Yeah.
Right? And then you have multiple decentralized units making that, and then it sort of becomes a norm. Right?
Exactly, yes.
Okay. So, I see a couple of questions here from the audience. And, okay, maybe we can take one. Are there particular pain points in patient care or hospital operations where you wish AI could play a bigger role but hasn't yet? Right? I know you have a second hat, right, as CEO of
MediCentre.
Yes.
Correct.
So maybe because that goes beyond
Yeah.
radiology, right?
Yeah.
So maybe
Yeah.
you can share about this.
Sure. So Parkway Radiology is actually IHH first ambulatory care center in the community. It is a one-stop center which has primary care, physicians, specialist care, diagnostic, allied health, rehab, all in one center. So in that space, there is also a lot of opportunities for AI to be deployed. I think one of the more common applications we are seeing maturing is the clinical notes, right? So as the physician is talking to patients, a software is transcribing the notes into the EMR or the clinic management system so that the clinician can spend more time giving the patient eye contact and not be typing on the computer while talking to the patient. So that's something we are hoping to trial. Of course, it's easier said than done because it involves quite a lot of change management as well in terms of how the physician interacts with the patient.
Right. Okay. Okay.
So in that space, there's a lot. I have a slide on our patient journey in radiology.
Okay.
So for AI to be adopted naturally, it assumes that your process is digital, right? You can't AI a piece of paper, at least not easily, right?
Wow. What is this?
So
patient
there's
journey?
Yes. So it's a progressive journey for any institution. And those of you who are in healthcare practice would know that healthcare is this strange mix of extremely high tech and extremely low tech all in one setting. What I mean is like certain of the processes are still quite behind, especially in terms of the non-clinical processes from patient registration and appointment booking, for example. So this is an illustration of a patient journey in Parkway Radiology. And we have been trying very hard to make every step a bit more digital, right? From the ordering, appointment, scheduling, result sharing, and from the front end and the back end. And once you are on that digital platform, then you can truly try and see what the AI opportunities are. So right now, a lot of the AI deployments and developments in radiology are very centered around the reporting stage. but there's so much opportunity way before that and even after that to improve the patient experience, the patient outcomes as well.
Okay. So yeah, right now it's quite, I guess, tool specific, or use case specific. But really, there's a lot within the larger healthcare environment.
Indeed, yeah.
I want to go to the next question. Are we showing it? Is IHH using AI in interventional radiology for real-time analysis to improve the accuracy of image-guided interventions?
Yeah, so thanks for bringing this up. So in Parkway Radiology in our hospitals, the other big strength we have is our interventional radiology program. So for those who are not clinical, interventional radiology is basically using minimally invasive image-guided techniques to diagnose patients, like biopsies, for example, to treat patients, drainages, embolisms, and all kinds of ablations. So it can do diagnosis and treatment using minimally invasive techniques and imaging. Right. So in that space, yes, there's a lot of ongoing interest about AI-guided guidance in interventional radiology. We've tried quite a few solutions that dabble in a few, especially robotic assistants. The interesting thing is these solutions actually help to level the playing field. So for learning institutions, university hospitals, the more junior doctors benefit a lot from the AI guidance, which helps them become more precise and shortens the learning curve, which very experienced clinicians have honed over the years.
Right.
For better or worse, in my setting, all my interventional radiologists are extremely experienced. So when they were trying out all this software, they don't see the marginal improvement in outcomes.
Right.
But for institutions that are different from us, I can definitely see that helping to accelerate the training of interventional radiologists.
Right. Okay. I actually have an interesting point, but I will go to the participants' questions before coming back to this. Other than apart from the three intended future, maybe we'll come back to this. But the next one, other than the 3 AI solutions you have implemented, what other areas? Oh, okay, I see.
Yeah.
Is most in need.
Yeah.
Wow, is most in need. Where is your pain point, the burning platform?
It's a follow-on to what I shared earlier. I think the upstream part of the patient journey for us, in our experience, has a lot of friction still. Getting the appointment, getting the patient registered, and things like that. These are very seemingly trivial parts of the process, but the patient journey doesn't just start from the imaging and results, right? It starts from the start at the referring doctor saying, you need a scan. And then there's a lot of friction in trying to get that scan. So I would want to change my own team's focus to look at solutions that can make the whole process easier for staff and easier for patients and make our services way more accessible.
Right. So that means when you put it in the work plan, do you try and categorize, right, the pilots that you would support, whether it is clinical tool or clinical decision support system versus something that is patient-centric, patient service improvement, or whether it's operational optimization? Do you think about it that way? Or
yeah, we certainly try and do it more balanced, and I would say a lot of it's also what we come across, right? So again, you saw the chart. A lot of the developments and solutions available out there in healthcare for radiology are still very skewed towards the diagnostic space. So we need to look beyond the realm of healthcare to find other AI solutions that have been very well adopted in other industries and bring it to us. So we're trying out, for example, we do a WhatsApp appointment booking system. So we're working with someone to use LLMs and optical OCR to help make the appointment booking process more automated and relieving, this is a true productivity gain, and also making the capturing of patient information more accurate. The other area which I feel that is starting to gain a bit more attention is what can help the technologist or the radiographer, right? So that's the people taking the pictures for you. There's also a growing shortage of them. It's also quite labor intensive right now. It's very dependent on having a human to perform the examination, but at the same time doing a whole host of other things. So there's a lot more interest in this space to make their work more error-proof, more easy from patient positioning, laterality to prevent errors in positioning and imaging. So these are things we're also looking into as well.
Okay. Okay. Thank you for you mentioned about showing value to clinicians to encourage them to adopt AI. During the POC trial, given this was still a stage of uncertainty, what was the top factor that convinced the clinicians that AI is good for them?
I suppose you would mean my users, so the radiologists in this case.
Yeah, sounds like
peer pressure. Peer pressure. Yeah.
So you need a champion, a change agent
Exactly.
who's influential.
So we never did big bang rollouts, right? We always had that first clinician lead, his group of like-minded clinicians who will start using it first.
Yes.
And then slowly spread the good word.
Yes.
And more people hopped on the bandwagon.
All right. Now, how do you identify this first agent of change?
We do have appointed radiologists who are leading our AI journey. So they're already on board, right? So that's very helpful. For each application, because we are subspecialty focused, our radiologists each have a certain area of interest. So it will really depend on the nature of the application we are looking to try out. Then we will match that with the like-minded radiologists of that subspecialty.
Okay, given that there is there's the power of word of mouth and professional convincing, right? How do they convince each other? Do they have formal education sessions or talks, or it's really a conversation in the hallway, or just
a combination of both? Of course, implicit in that is that the solution is pretty good, right? Then what you're trying to overcome is mindset, resistance to change, and that's where all these like socializing and peer pressure as a bit of a joke helps to get people over that initial hesitation and resistance to embracing it.
Okay. So you also mentioned that, a lot like the case of interventional radiologists, the IRs are very experienced and they don't see the marginal help that AI could bring to them.
Not yet.
Is there ever a fear of de-skilling? We talked about this a little bit.
Correct.
Is there a fear that, if people start using AI, that they're going to lose touch, or lose some of their skills? Any thoughts on that?
Yeah, so the analogy we were joking about is, we invented automatic cars, right? And then if you drive an automatic car, after a while, it's like saying, okay, I'll forget how to drive a manual car. But is that so bad to forget how to drive a manual car? In this case, yes, certainly I think there is something to be very aware of. And more recently, I think it was reported in the news that some institutions are actually implementing AI-free days to prevent this de-skilling from happening, right? I have a slightly different view about how to manage this. I think it's something that we should be aware of. But at the same time, if we are clear that AI is here to stay, then we should just see how we adapt and evolve the way we work to keep that reliable second reader, that reliable reading partner next to us to ensure that we keep making the best reports and most accurate reports for our patients.
Right.
Yeah.
Okay. So there hasn't been a request from your radiologist, right, to have an AI free day?
I think if I suggested it, I would have a riot.
Wow. Okay. You get the calls. Why isn't it on? Right. Okay. Right. Okay, great. So I'm mindful of the time, and I just kind of want to, I guess, add on to one final question, right? Do we have any more questions from okay. Is this okay, we got two more. So we'll do this, try to do this quickly. Medical cost is getting very expensive. Will AI help to bring down costs for patients or add to costs? Right. Do you pass on the costs? Yeah. How will this?
We have not passed on the cost.
Oh, wow. Okay.
Fully. I think like any new technology, there's a certain cost curve, right? In the initial stages, there will certainly be an increase in costs, which depending on the projects and deployment, we absorb most of it right now.
Wow.
Because we're still relatively early in the stage of adoption of AI.
Right.
And then once you can really harness it as a system, then you can talk about productivity gains. And that's when you can pass on the savings to patients. But as of now, I would say, I think the altruistic aim is to bring down cost to patient.
Right.
But there might be some initial learning curves which will require adding to the cost, unfortunately.
Right. Okay. But I think from a business value, you see the volume increases already there.
For the particular deployment, yes.
Right. Okay. And then we have one final question. Having such a large team, do you see any traits common across your colleagues who are more keen to adopt AI? And is factors like age and experience, do they play a part?
It's very careful how I answer this. Certainly the ones that are more keen tend to be of a certain demographic. They are the younger ones who also use AI in other aspects of their life, right? Whether it's ChatGPT or any other,
And they learn to code.
Yes, those are
Wow.
the. I've some radiologists who are so into it that they have built their own reporting software on their site, right?
Wow.
Yeah, I don't know about that. Yeah, so certainly yes, but I do believe that awareness and seeing the value in the solutions that it can bring to an individual or a team can overcome things like age and experience, because just from a lack of experience or having too much experience, you may be a little bit more fixed in how you think about certain things. So I think my role is to just make sure that we keep at it, we keep talking about it, we keep trying things out, and keep making everybody informed that, like, hey, we are on this journey, right? And you have a part to play in it, and that everybody can truly benefit from any small or big AI deployment that we put in place.
Okay. And I see we're just close to time, but I have one final question.
Okay.
If you had a parting point or a tip to leave for any management or just even someone who is very keen to adopt AI in their workplace, what tips would you give for them to practically and responsibly implement this well?
Well, just one. Okay, I think one of the lessons we've learned in order to be able to move forward, right? Maybe not to be too fixated on the perfect solution, right? Every solution out there will have its flaws and will have some adaptation required from your workflow or in your process, existing processes. If you keep looking for the perfect solution to fit and check all your boxes, meet all your metrics that you have set forth and presented to your CEO before them, you will keep searching. So at some point, you need to realize what's good enough and then just start. And then you will learn from it. And if it doesn't work out, at most, like I said, most of them are pay-per-use, right? You just stop the deployment, right? But you have to start somewhere. And yeah, just know what is good enough and then move forward with that. And then put in all your other checks and balances and other ways to make sure that it keeps evolving with the way you adopt it.
Wow. Okay. Thank you. So we're almost close to time. I just want to highlight, I guess, some key learning points that I've taken from today's conversation. One is that you don't have to have a technical or clinical background to implement change, to start change, even in AI. That's one, right? Two is, I think you have to get your right partners on board.
Yes.
Right? Get your change agents, get your influencers, and having a multidisciplinary team is key, right? Your SWOT team, your initial SWOT team comprises both a business leader as well as a clinical leader, but as well as an IT leader, right? Because everyone has to have sort of an equal say at the table to bring this forward, because the AI is not just about that tool, plot, and then that's it. It's really end-to-end workflow changes, and even thinking about what means success, right? Because your initial thoughts about operational improvement may not pan out, but there are benefits in other ways, right? And then being patient, because it doesn't have to be perfect at the start, but leadership plays a key role, because you have to, I guess, encourage your staff, give them the space to experiment, but keep them accountable by, maybe letting them have certain KPIs in which they should try, explore.
Yes.
Maybe not implement, but at least explore.
That's correct.
Right? What tools can be implemented. And there's so much more opportunity beyond just radiology, but the entire healthcare experience. So thank you very much. It's been a great pleasure having you here. I certainly learned a lot from you today, and I hope that the participants took away some insightful points as well. Thank you, everyone, for tuning in. And before you go, we'd really like to hear from you as well. Please feel free to scan the QR code to share your feedback. If you have any follow-on questions or maybe topics you'd like us to explore for future sessions, feel free to include them in the survey, and we'll do our best to get them answered. Our contact details are also on the screen if you'd like to connect with us. And on behalf of all of us at NUS ISS, thank you, Yujuan, for the insightful sharing today. Thank you, all your participants, for joining us at the NUS ISS Learning Festival 2025 online edition. And we look forward to seeing you again at our next session. Thank you, everyone.
Thank you.